Hello, I'm Professor Peraza, and today's lecture video covers nutrition and exercise. These are the specific learning objectives for this module. After this lecture, you will be able to explain the benefits of engaging in a consistent physical activity routine, identify fuel sources utilized during various forms of physical activity, design a well-rounded beginner exercise routine, apply nutrition principles with athletes. This module also meets the following course learning objectives. The Physical Activity Guidelines for Americans, issued by the Department of Health and Human Services, recommend that individuals engage in physical activity at least 150 minutes per week for moderate intensity aerobics or 75 minutes of vigorous intensity aerobics, and also include 2 or more days of muscle strengthening activities. With muscle strengthening activities, the focus should be on activities that involve all major muscle groups. For substantial health benefits, 300 minutes or more of moderate intensity aerobics or 150 minutes or more of vigorous intensity aerobics are recommended. Ideally, physical activity should be spread throughout the week. Although these are the recommendations, not everyone will be able to start with this level of activity. There are many benefits of being physically active. Some of the benefits include longer health span, delaying the onset of 40 chronic diseases, including cancer, cardiovascular disease, depression, diabetes, and hypertension. Physical activity also improves cardiorespiratory fitness, mental health, and muscle mass and strength. Improving your overall fitness involves sticking with a physical activity program on a regular basis so that being active becomes part of your routine. Designing a well-rounded fitness program involves the following components: cardiorespiratory fitness, musculoskeletal fitness, flexibility, and balance. The Physical Activity Guidelines for Americans defines cardiorespiratory fitness as the ability to perform large muscle, whole body exercise at moderate to vigorous intensities for extended periods of time. With cardio, you are utilizing large muscle groups in a rhythmic manner, continuous in nature. Your heart and breathing rate also increase. Examples of aerobic activities include walking, running, swimming, jumping rope, and cycling. Certain aerobic activities also contribute to bone health if they are weight-bearing. Examples include running, walking, or jumping jacks. The Physical Activity Guidelines for Americans defines musculoskeletal fitness as the integrated function of muscle strength, muscle endurance, and muscle power to enable performance. Engaging in weight or resistance training enhances musculoskeletal fitness and involves anaerobic metabolism. Short duration, high intensity movements rely on immediately available energy sources and require little or no oxygen during the activity. Examples can include weightlifting, using resistance bands, or utilizing your body for movements like push-ups or pull-ups. Flexibility is the ability to move a joint through the full range of motion. Activities like yoga, Pilates, and stretching exercises improve flexibility. Lastly, balance, which is the ability to maintain equilibrium during movement or while stationary. Balance activities include Tai Chi, yoga, and using a wobble board. Before designing a fitness program, you want to think about what your goals are. Different goals are going to mean different programs. In designing a fitness program, one tool you can utilize is the FIT principle, which stands for frequency, intensity, time, and type. Frequency is how often you exercise. Intensity is how hard you work during the exercise. This is often measured by heart rate. Time is how long you engage in activity. And lastly, type is the kind of exercise you are doing. When designing your exercise program, you want to create a plan that's fun and flexible with your lifestyle. I mentioned exercise intensity, so let's talk a little bit more about ways to measure. The first method is with the talk test. In general, if you're doing moderate intensity activity, you can talk but not sing during the activity. If you're doing vigorous intensity activity, you will not be able to say more than a few words without pausing for a breath. For heart rate, you can estimate your maximum heart rate by subtracting your age from 220. In terms of a target heart rate, if you're doing moderate intensity activity, you want to aim for between 64 and 76% of your max heart rate. For vigorous intensity exercise, a target heart rate range is between 77% and 93%. Another method is to use the Borg rating of perceived exertion, or RPE. The RPE is a subjective measurement of how hard you feel like you are working. The scale ranges from 6 to 20, with 6 feeling like there is no exertion at all, and 20 being maximal effort. Generally, you might aim for an RPE of 12 to 15 during exercise. I reviewed in previous lectures that we need to convert the energy in foods to ATP. At rest, our heart and lungs supply our muscles with oxygen to meet our energy needs through aerobic metabolism. Once we start exercise, our muscles are the first to respond as our heart rate and breathing rate increase. Our muscles contain a small amount of ATP, however, this is only keeping the muscle working for about 1 to 2 seconds. Once that stored ATP is utilized, the body utilizes creatine phosphate to convert ADP to ATP. After 10 seconds, stored creatine phosphate is also used up. At about the 15-second mark is when the muscles produce ATP by anaerobic metabolism, which is quick but not efficient in terms of the amount of energy, and also glucose is the only energy source. The glucose needed for anaerobic metabolism comes from muscle glycogen. After about 2 to 3 minutes, the heart and breathing rates have increased enough to supply oxygen to the muscles, and this leads to more ATP being produced. Remember, aerobic metabolism fuel sources can include carbohydrates, fatty acids, or proteins, though carbohydrates are preferred. The amount of oxygen that is delivered to the tissues via the cardiovascular and respiratory systems during exercise depends on the duration, intensity, and physical conditioning of the individual. During low-intensity activities, aerobic metabolism is used to supply enough ATP to muscles. This is the preferred energy source for low-intensity exercise is fat. However, during high-intensity exercise, more ATP is needed, so the muscles must rely on anaerobic and aerobic metabolism to meet the body's needs. We have talked about the importance of carbohydrates already, especially with exercise. Carbohydrates are an important energy source for the muscles during exercise. At light activity, though fat is the primary fuel source, carbohydrates are still being utilized. Carbohydrate needs for athletes range from 3 to 12 grams per kilogram of body weight daily. At light activity levels, 3 to 5 grams per kilogram of body weight per day for carbohydrates are recommended. For moderate activity, 2 to 3 hours per day of intense exercise performed 5 to 6 times per week, athletes typically need to consume a diet consisting of 5 to 8 grams per kilogram a day. At very high activity level, so 4 to 5 hours per day of moderate to high exercise, 8 to 12 grams per kilogram of body weight are recommended. This will aim in maintaining liver and muscle glycogen stores. If an individual is involved in general fitness, they can aim for the AMDR of 45 to 65% or the 3 to 5 grams per kilogram of body weight for carbohydrates. With any individual, the emphasis is on whole carbohydrate sources like whole grains, fruits, and vegetables. Any refined carbohydrates should be limited to times when glycogen resynthesis needs to happen quickly. Generally, the AMDR of 20 to 35% for lipids also applies to athletes. In certain instances, a higher proportion of dietary fat could be recommended during high-volume training. If an individual is looking to reduce body fat, dietary fat can range from 0.5 to 1 gram per kilogram of body weight per day. It isn't recommended to go below the 20%, as the concern is the availability of fat-soluble vitamins and essential fatty acids. Although most of the fatty acids are stored as triglycerides in the adipose tissue, about 90%, there are some triglycerides stored in muscles. As a reminder, fatty acids are the preferred fuel source for low to moderate exercise with aerobic metabolism, but fatty acids cannot support intense anaerobic activity. Although protein is not considered a major energy source, small amounts of amino acids are used while resting or doing an activity. When exercise continues for many hours, amino acid use will increase as an energy source and for glucose synthesis. If an individual is working on building or maintaining muscle mass, the recommended protein range is 1.4 to 2 grams per kilogram body weight per day. Some newer research shows that greater than 3 grams per kilogram body weight can have a positive effect with individuals involved in resistance training, leading to a decrease in fat mass. If an individual is involved in general fitness, they can aim for the AMDR of 10 to 35% or the 0.8 to 1.2 grams per kilogram body weight for protein. It is recommended to space out protein throughout the day, every 3 to 4 hours or so. We will discuss micronutrients later in this course. However, both vitamins and minerals are important for athletes. Vitamins are classified as fat or water soluble and are needed to regulate metabolic and neurological processes and energy synthesis. Minerals are important regulators of the metabolic and neural control and serve as components of enzymes and hormones. Needs for micronutrients for athletes can generally be met by a well-balanced diet that also includes an adequate amount of calories. There is some research to support emphasis on getting adequate amounts of certain vitamins and minerals for heavy training. This includes vitamin E and vitamin C for maintaining a healthy immune system, vitamin D and calcium for muscle health and strength, and iron for individuals prone to anemia or deficiency. Some minerals to keep an eye on would be sodium, potassium, and magnesium with fluid losses. It is not recommended to increase dosages of vitamins and minerals beyond the recommendation. Keeping well hydrated is important for not just any individual, but also athletes. Water is needed to cool the body, transport oxygen and nutrients, and remove waste products from the muscles. With 2% losses of water through sweat, exercise performance can be significantly impaired. This can happen even within an hour to a half of exercise. While 2% can lead to impairment, more than 4% of body weight loss during exercise due to water loss can lead to heat illness, heat exhaustion, heat stroke, and possibly death. The recommendations from the ISSN regarding fluid intake are to consume 500 milliliters of water the night before an event, 500 milliliters once a week, and then 400 to 600 milliliters 20 to 30 minutes before exercise begins. While exercising, fluid should be consumed at 0.5 to 2 liters per hour, which means about 12 to 16 ounces every 5 to 15 minutes. After exercise, athletes should consume 3 cups for every pound lost during exercise. Sports drinks can be beneficial for athletes to supply not only electrolytes, but also fluid and carbohydrates. Sports drinks are generally not recommended unless exercise is at high intensity and lasting longer than 1 hour. Less than that does not lead to any extra benefit over water. It is also not recommended to just rely on thirst for hydration, as many people do not get thirsty until they've already lost fluid. We covered general needs for athletes. However, I want to touch a bit on the pre and during exercise nutrition. Pre-exercise intake helps maintain optimal levels of energy for the muscles and also keeps the athlete from feeling hungry. It takes about 4 hours for carbohydrates to be digested and stored as glycogen. When planning a pre-exercise meal, ideally it should be 4 to 6 hours from the exercise event to top off glycogen storages. A light snack 30 to 60 minutes prior to exercise can also help with increasing carbohydrate availability toward the end of an intense exercise bout and decreasing the breakdown of protein, meaning less muscle damage. The light snack should be ideally protein and carbohydrates, 50 grams carbs and 5 to 10 grams protein. If exercise is more than 1 hour, glucose and electrolytes can be beneficial to maintain blood glucose levels and prevent dehydration. Beyond 90 minutes at high intensity, carbohydrates should be consumed at a rate of 30 to 60 grams in a 6 to 8% carbohydrate electrolyte solution, 6 to 12 fluid ounces, every 10 to 15 minutes. For recovery nutrition, we are still prioritizing carbohydrates and proteins, with carbohydrates aiming for 1 gram per kilogram of body weight and then 0.5 grams per kilogram of body weight for protein. Within 30 minutes can be a strategy for refueling after intense exercise when rapid glycogen restoration is needed, or if the individual does not consume adequate carbohydrates in the diet, so less than 6 grams per kilogram a day. This should be followed by a high carbohydrate meal within 2 hours after exercise. The optimal time period during which to ingest protein is likely a matter of individual tolerance, since benefits are derived from the pre- and post-workout ingestion. It's also important to note that the anabolic effect of exercise, lasts at least 24 hours, so early ingestion of protein and carbohydrates post-workout does not need to be done within that 30-minute time frame unless absolutely necessary.